We're joined now by Daniel Hannan, whom I think you know, the wonderful British member of the European Parliament who startled and educated the world by a speech that he gave on the floor of the British Parliament in the presence and to the face of Chancellor Gordon Brown. Daniel Hannan, welcome back to Freedom Watch.
Thank you for having me back on, George.
One of your favorite American heroes, Congressman Paul, is here with us, speaking from his congressional office in Texas, because you are standing where he usually stands in the rotunda of the Capitol building, and we're just talking about health care. You have lived and grown to adulthood under the British National Health Service. Would you wish that on a free market like we have in the United States, Mr. Hannan?
I wouldn't wish it on anybody. We have a system where the most salient factors of it are you get huge waiting lists, you have bad survival rates, you would much rather fall ill in the US than in the UK. You know, if you get cancer, if you get heart disease, you get stroke, 5 years on, the chances are here you are going to be healthy. In the UK, you're not. Why do we stick to it in the UK? Because there is such a huge vested interest. There are so many people now who depend on it. We have 1.4 million employees in the NHS in the United Kingdom. It's the third biggest employer in the world after the Chinese Red Army and the Indian National Railways. And that means that electorally it's almost impossible to get rid of the thing, even though most of those employees are administrators and are bureaucrats rather than doctors and nurses, and even though the people in the system, the people working for it, are ruthlessly exploited because it's a monopoly employer and are very badly paid. But that is such a big conservative bloc in the sense of being resistant to change that it's something you almost can't politically get rid of. And that's why, you know, don't believe, if you're watching this program, don't think that you can experiment with one of these things and then reverse it if it doesn't work out. That's not how it happens.
Congressman